Hey everyone, it's Tim Reha here live at the Digital Health Live Studio, CES 2014. Super cool panel. This is probably one of the coolest panels going on today, called the Radical Hospital. We've got Orlando Portale, who is the Chief Innovation Officer of Palomar Health. Did I get that?
You did.
All right.
Yes.
We're just kind of getting the blood flowing today. It was like such a big day yesterday.
That's right.
How's your CES going?
Oh, God, this is huge. Yeah, it's gigantic this year.
I've got both my fitness trackers are smoking from all the walking.
This is the wearable event of the season.
It's pretty much that's kind of the theme, right?
Exactly, wearables.
So there's a lot of exotic technology discussions going on there. You're speaking about Google Glass and things. Give everybody a little brief about your background and what you do.
So I'm the innovation officer with Palomar Health, and Palomar Health is the largest public health care district in California. We operate hospitals and clinics throughout Southern California.
Okay, and what's your background?
My background is in technology. I ran the healthcare vertical globally for Sun Microsystems,
Oh, nice.
and then I've done other things in the academic world as well.
So who was on the panel and what were some of these radical things that are entering the hospital space?
Well, we had a good cross-section of some folks from IBM and other companies, and one of the things that we really highlighted is the R&D that we're doing with Google Glass as a platform.
Yeah.
And we did a live demonstration of some mobile apps that we built for Glass through an effort called Glassomics. And Glassomics is a R&D effort at Palomar being funded by Qualcomm. And we're doing hardcore R&D to see whether glass can be used by physicians in terms of treating patients.
What's going on from the patient's perspective and having that experience? Or they feel like they're looking at they're getting watched, or what's going on there?
Well, the apps that we've started with really don't deal with videotaping the patient. It's really about, as you're talking to the patient, we're providing reminders to the physician about some things that they might want to think about relative to the symptoms associated with that patient. We're providing a real-time differential diagnosis back to the clinician, and that's what we just demonstrated there. It's a very interesting sort of approach.
Very cool. So tell me about the innovation lab. That's pretty unique.
Yeah, my job is to work with startups pretty much. I'm the entrepreneur in residence for my organization, and I bring startups in, we collaborate with them, we do joint R&D, and then in some cases we've actually invented technology. Recently we invented some technology that we licensed to a Sequoia-backed company called Airstrip.
Yeah, I saw Airstrip down in mHealth Summit.
Yeah, they're a very innovative company. They've licensed our technology and they're bundling it in the Airstrip One product.
Okay. And what else was kind of going on with some of the other speakers in the panel that you thought was hot?
Well, I think the big trend is in terms of analytics and using analytics on the back end to analyze information that's being collected throughout the healthcare system, and then to provide predictive modeling and other information back to caregivers. That's the big trend.
And that's going to take a while. What's the time frame when we're going to really see some robust analytics and predictive analytics?
I would say we're about 3 years, 3 to 5 out before we've got a good handle in terms of collecting all that disparate data and making sense of it.
Okay, the last question is, what's really bringing you to CES and what are you trying to get out of the event this year?
Well, I come to events like this just to get up to speed in terms of what's going on in the consumer sector. It's interesting, the dynamic that the consumer side in electronics has really taken the fore from the enterprise side. Right? iPads, mobile devices. And so an event like this really gets me up to speed in terms of what's going on in that space, and then think about how you can apply that to medicine. And this is the place to do it.
Totally. All right. Well, hey, Orlando, thanks so much for being on the show. We will catch. What's up next for you?
I don't know what's up next for me. I'm going to get some rest.
All right. Thank you.